Hi there, my name is Sherry and I am part of the psychology team at the Centre for Play Innovation. So we promised we would send you some information on attachment and trauma. So that is what we are doing. So one of our special areas of interest is in attachment and trauma. And I think in the coming weeks and months, this is going to start to become increasingly relevant for us. So possibly a good place to start is, what is attachment? So attachment theory sort of really gained prominence after World War II. Originated with a man by the name of John Bowlby. I'm not going to go into that because you guys don't need to know that. But basically what attachment is it refers to the emotional tie that an infant has to a primary caregiver. Now that can be mom or dad or granny or sister or brother, but basically it is that primary attachment in an infant's early life. It's that emotional tie in an infant's early life. So attachment forms as a result of caregiving, and one can get an insecure or a secure attachment. For the purposes of today's video, we are really just going to be focusing on secure attachment, and we'll chat a little bit about insecure attachments at a later stage. So when an infant receives good enough parenting, that's not perfect parenting, it's good enough parenting. And what that means is that mom, I'm going to use mom just for the purposes of today, but it could be granny, dad, whoever. Mom responds to the infant in a timeous manner. So baby is crying, baby needs to be soothed, baby needs to be rocked, baby needs to be cared for, fed, changed. Now when that is done predictably and consistently and with warmth and with soothing voice tones, what that signals to the infant is that I'm safe, I'm loved, and the world is safe and predictable. I know that mom will respond to me when I have needs, and I then understand that the world can also be responsive to my needs. So this is the foundation of secure attachment. Oh. And then we get something called attachment behaviour. So that's the behaviour that you're going to notice when an infant needs something, like now. Yes. So an infant's behaviour is going to signal to you what kind of attachment, what kind of need they have, rather. Getting a little distracted here. The attachment behavior that you might see would be some clinging, whining, tantrums, maybe even some avoidance or aggressive behavior. But basically what that's saying is, I'm feeling dysregulated. I'm not feeling okay in myself for some kind of reason. And mom, I need you to soothe me. I need you to respond to me, and I need to know that I matter. Okay. So, excuse me. Oh. Yeah. So right now, this is Evan, and Evan is showing some attachment behavior. Perfect timing. So when mom is responsive to those needs, baby learns that I'm safe and I'm secure. As they start to become a little bit more mobile, what they're going to do, and you'll see this around the age of 2 or 3, is they start to explore their world. And they might sort of go off and have a look at something, and then they're going to look back and check, hold on, is mom or dad nearby? Is it safe for me to go and explore whatever it is I'm exploring? So that attachment behavior and the secure attachment means that I can explore my world and I can learn from my world. And that's really what we want to see in a caregiver and infant relationship. Sometimes that doesn't always go according to plan, and attachment disruptions or attachment injuries can occur. And I'll focus some special time specifically on that. So now we find ourselves in the midst of COVID-19, and it's a very uncertain place for us as parents and caregivers, for us as therapists and healthcare providers. What does this mean for attachment? And these are, I think, really important questions. So we find ourselves, certainly in South Africa at the moment, in lockdown. And that gives us... sorry, I'm getting distracted here again. So we find ourselves in lockdown, and we're needing to provide a sense of security to our kids. We're needing to be that secure base to our kids. Now that can be challenging if we ourselves have encountered a history of trauma or attachment injuries or attachment wounding. So what we're going to do is I'm going to attach a link to a questionnaire that sort of links to adult attachment. There is such a thing as adult attachments too. And I'd encourage you to find out what your primary attachment style is, because it is very likely, oh dear, that you are going to be parenting from that attachment style, and that can either make it very easy to regulate and provide a stable and consistent environment to your kids, and to provide that security, or it's going to make it very, very challenging to regulate. And I think now's the time to start looking at your attachment style, to start looking at your parenting style, and figuring out what comes easily, what's a little bit more challenging, and how's it playing out in your relationship with your kids. We certainly don't have all the answers. We're navigating this along with you guys. What we do have is a little bit of information that we'd like to share with you, and we hope that it'll be useful to you guys. So this is the start of that thread, and I hope you guys will find it valuable. We will talk again a little bit more about security, about creating a holding environment or a holding space, as well as attachment injuries. So take care, everyone. Be safe, and we will see you again.